Hello everyone, I'm Thea from First Aid for All. If you've watched my intro video, you know this is part of my Girl Scout Gold Award project, and it aims to increase public access to first aid education for children and adolescents. Please leave any feedback in the comments if you have any ideas for my project, and please let me know if you've learned anything from this video. Thank you so much for watching. If you remember, in our last video, we talked about wounds and infection to wounds and things we can do to help someone if they do get a wound. In this video, we'll be talking about shock, which can happen a lot if someone has a bad wound that's bleeding a lot. So let's just get right into it with the definition of traumatic shock. So traumatic shock is when body functions just stop working as a result of lack of blood circulation throughout the body, and it always happens after an injury or a very scary event happens. So the causes of shock are injuries like burns, fractures, or just pretty bad wounds. It can also be caused just by a loss of blood or by something very shocking, something very scary. The worse the injury is, the more likely a person is to go into shock. So some dangers of shock is that it can be made worse if a patient is handled too roughly or if more blood is lost, and shock can even cause someone to pass away if it goes on for too long, because lack of blood flow is very dangerous for our bodies because everything in our body needs blood to survive. It brings the oxygen from our lungs all throughout our arms and legs and stomach and pancreas and all of our organs. So it's really important that we help someone if we think they're in shock. So because shock is sometimes a less known condition, especially with kids, you might not know a lot about it. So some symptoms of shock a person can look weak or pale. They can have sweat on their skin even if it's not hot outside. On their upper lip, on their face, they can be sweaty, and even on their forehead. They can also be nauseous, or they might throw up. They also might be angry or anxious, agitated, or just seem out of it. So another sort of trademark symptom, a symptom that you see a lot with shock, is they might have a weak pulse. As we talked about in our second video, you can find pulse by locating this vein on your arm, putting 2 fingers and putting them right there, and you will feel a pulse. And that's your heart beating through your body. So if you don't feel it very strongly, or if you don't feel it at all, but they're still breathing, it means they might be going into shock. Their breathing might be shallow and irregular, but it can always be confused as fainting. So make sure that a person isn't just fainting first, because the two, shock and fainting, are sometimes confused. So the best thing to do is, if someone is fainting, kind of treat it as shock, because shock can be dangerous. So always just be sure to treat it as shock, just in case, so the person can get the help they need. Great. So what to do when a person goes into shock? Make sure they're lying down, because this helps their blood flow remain stable throughout the body. Like you may know, walking across a surface is easier than running uphill. That's kind of what our blood goes through in our body. So if it's just going straight, if a person's lying down, it's easier for it than if we're standing up, because then it has to go up and down and up and down. So make sure the person's lying down, because this can help their blood get through their body better. The only time you probably shouldn't use this position is if the person has a lot of bleeding, because that might make them bleed more. But always make sure to call 911 first and ask them what they advise. If there's a lot of bleeding, make sure to elevate the legs and the hips, because this can help stop blood loss. Do not add heat to a person with shock. Just make sure they're not getting cold. Make sure they're not losing heat, because heat is very important for our body to remain active, but adding heat could make their shock worse. Also, make sure the patient is drinking, they're not dehydrated, because if they are, it may just be fainting, it might not be shock. But as a whole, always call 911, make sure to talk to a medical professional before doing things. Just always make sure you have the advice of someone around, and just make sure the patient is safe and that you can help them. Thank you so much for watching today's video. I hope you enjoyed it and I hope you learned something. Please make sure to let me know in the comments if you learned something. Our next video is going to be about artificial respiration, and I really hope you watch it. So please let me know if you learned anything, and I hope you have a great rest of your day. Bye!